Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at AHA 16 in New Orleans. Today we are joined by Dr. Jeff Healey from McMaster University in Canada. Thank you for joining us.
Thank you for having me.
So Dr. Healey, could you please tell us more about the aims and objectives of the ASSERT II trial that you'll be presenting?
Well, the ASSERT II trial is a study of individuals over the age of 65 with stroke risk factors. And the primary goal of the ASSERT II trial was to see how frequent subclinical atrial fibrillation is in this population. From the ASSERT trial, we know that subclinical atrial fibrillation is common in individuals with pacemakers and defibrillators, and this was a convenient group of patients to study because they already have a device in place which can monitor for such arrhythmias. ASSERT II is really asking the question, is this the same in the general population of patients without pacemakers? Because, of course, there may be something unique about the pacemaker ICD population that puts them at greater or lower risk. So the ASSERT II trial was designed to recruit patients who are over the age of 65, who had at least two of the CHADS-VASc stroke risk factors and had some other marker of increased risk of atrial fibrillation, either an increased left atrial size or an elevated NT-proBNP. And they were implanted with a St. Jude Medical implantable loop recorder to monitor for atrial fibrillation over an average of 16 months.
Wonderful. And what did you find with the trial, and how will we apply those results in clinical practice?
Yes, so the trial was quite interesting in that we found a great deal of atrial fibrillation. So the annualized rate of atrial fibrillation or subclinical atrial fibrillation detected, which lasted at least 5 minutes, was 34.4% per year, which is a very high number. And if one looks into the half of our population with the largest left atrial volumes, this rate of detection was over 50% per year. So it does speak to the fact that subclinical atrial fibrillation is very common in an increased risk group of individuals over the age of 65. So this has several implications. First of all, patients over the age of 65 with stroke risk factors, it may be worthwhile to screen to look for atrial fibrillation, or conversely, it may also be worthwhile to evaluate strategies of empiric anticoagulation in certain high-risk groups. But at this point, all we can say is that the subclinical atrial fibrillation is very, very common, and that it really is an incentive for us to look harder since we have such effective therapies for stroke prevention.
That's great. Can you tell us anything about stroke risk in these patients who had detected AFib in this way?
Yes, so the study really was not designed to look at stroke risk, and this was mainly because the sample size was small and because there was a lot of co-intervention with anticoagulants. So ASSERT I was done in an era where anticoagulation was with warfarin, not commonly done for short-lasting episodes, and we could estimate the stroke risk. Here, approximately 30 to 50% of individuals who had subclinical atrial fibrillation detected were started on an anticoagulant for one reason or another. So we can't really answer the same question we did in ASSERT by this means. However, there are a few other interesting things we can say about stroke. First of all, roughly half the population of ASSERT II had a history of stroke. Now, not necessarily a cryptogenic stroke or an embolic stroke of unknown source, but stroke in general. These patients were modestly and non-significantly more likely to have subclinical atrial fibrillation detected. So this is an interesting finding. Secondly, we found a much greater rate, or at least one can say the same or greater rates of subclinical atrial fibrillation than were found in the post-stroke trials such as EMBRACE and CRYSTAL AF. And so I think this trial does give us a little pause to be somewhat more conservative with our interpretation of those trials in concluding that when atrial fibrillation is found after an embolic stroke, that this was indeed the cause, because what we are seeing here in an over 65 population is an extremely high background prevalence of subclinical atrial fibrillation.
Wonderful, great. Well, thank you so much for sharing the results with us.
Thank you.
All right. For more videos like this, please go to youtube.com/FITsOnTheGo.